Tears! Why did you do that?
It's hard for Eloise and her mum Carmel to look back on this family celebration.
I think this is a fairy tale wedding of two perfect people.
Within a year, their father and husband Peter was seriously ill.
I would like to propose a toast.
Dad was diagnosed with throat cancer. He was quite advanced at the time of diagnosis.
When Peter returned home after surgery in January, the 74-year-old was assessed and approved for aged care support services at home.
What wasn't clear to us, that then there was an additional 7 to 9 month wait for the funding.
When the 74-year-old was diagnosed as terminal, the family was advised to get an urgent reassessment.
Dad's needs were increasing by the moment. You know, we needed personal care assistance, we needed nursing.
The reassessment was to be done by a company that had a government contract to do the work called Aspire for Life.
So it was put to Aspire for Life that we needed a really urgent reassessment. Aspire for Life gave Mum and Dad a reassessment date of 8 weeks into the future, and that was the most urgent time they could get there.
The support Peter needed never came. He died 4 weeks before his urgent reassessment with Aspire for Life.
My mum spent those last few weeks absolutely burnt out and exhausted caring for someone on her own with no support, despite hours and days and weeks of us just on the phone to these people.
For the past 40 years, clinicians from State Public Health, called Aged Care Assessment Teams or ACATs, decided what level of support elderly Australians received, whether it be at home or in residential care. Last year, the federal government decided to partially privatise the system, awarding contracts worth more than $1.2 billion to more than a dozen companies to do the job. The waiting list for assessments now sits at 116,000. That's almost equal to the number of Australians who are actually waiting for a home care package, which is now at 120,000. Aspire for Life was responsible for an assessment for support services for Peter, not his medical care. In a statement, the not-for-profit said it couldn't comment on his case, but said the high demand for assessment services is universally acknowledged and it was investing to meet demand. The pressure on the system is evident around the country, including here in Cairns.
Things are just not happening and I just don't know where to go.
Coral Wilkinson, a former ACAT assessor, now helps people navigate the system and deals with a range of assessors in Queensland.
Murray, I've got your back.
She's been overwhelmed by calls from clients.
Some people are waiting 9 and 10 months and their cases are urgent and they don't know when they're going to be assessed and their families are at breaking point.
Through her podcast, people in the sector tell Coral the new system is failing because some organisations don't have skilled staff to do assessments.
I think there was some naivety on the part of the department and perhaps some of the newer assessing organisations who didn't really understand the level of knowledge and expertise that is required to assess older people who particularly have higher and more complex needs.
The 2021 Aged Care Royal Commission called for changes to simplify the assessment system, but it didn't recommend privatisation. It recommended that assessments be done by people independent from approved providers to avoid a potential conflict of interest.
If an assessment organisation is also an approved or registered provider of in-home services, there's that, potential conflict of interest or risk that the assessment organisation can then channel people into their provider.
The ABC has found that more than half the companies awarded contracts are also home care providers or have a connection with one. A spokesperson for the Aged Care Minister Sam Ray said the government had robust arrangements to prevent conflicts and the department can take action, including terminating contracts if a conflict was identified. Former clinical assessor Janine Mason quit after 3 months with another assessment company because she says she wasn't given enough time to properly assess people.
Many assessors feel this pressure to get these assessments done. It's coming from departmental decisions that are pushing down onto then companies that must remain viable and keep their contracts.
Even more disturbing for her was a practice that she says saw elderly people dropped off the waiting list if they didn't answer phone calls in time.
We were advised 3 calls were to be given. If they don't respond to those calls, then that referral would be rejected. There are many reasons why 3 calls is not an appropriate way to then reject people out of a system who've been waiting months and may not realise they've been rejected out of the system.
Janine's former employer said there had been a department guideline to this effect, but that their organisation had not adopted this policy. The government has strict KPIs for the new assessors, including that 90% of urgent assessments be done within 10 days. At Senate estimates last month, the department denied reports that KPIs had been abandoned.
Is it true that the department's abandoned KPIs for wait times for assessment agencies?
No. So we haven't abandoned.
Have they changed?
They haven't changed.
But the department acknowledged the KPIs will temporarily not be enforced.
Have they been temporarily waived?
We have indicated that during the initial transition to the single assessment system workforce, we won't be enforcing those KPIs for approximately the first 12 months of the system.
The government says the median wait time for an assessment is 23 days, but providers and families say people are waiting months.
I've been working in this space for a long time. I would go so far as saying it's the worst I've ever seen it. I haven't seen such a delay for people to get their aged care assessment.
I really despair for the amount of vulnerable elderly Australians. Probably it's too hard to sit on the phone and navigate the bureaucracy that is the system.
So brave.
Yeah, I think this process shows we had to speak for him and we still got nowhere.
At the weekend, the government introduced a new payment system as part of its aged care reforms where older Australians will make a contribution to their home care packages with hardship assistance if they can't afford it. Sam Ray is the Minister for Aged Care. I spoke to him earlier. Sam Ray, welcome to 7:30.
Sarah, thanks for having me.
Australia, like many countries, faces an ageing population. Is this suite of reforms that the government has devised enough to meet that oncoming demand?
You're very right, Sarah. We do face an ageing population. It's one of the great public policy challenges of our time. And we want every single older person across Australia to be able to access safe, dignified and high quality aged care services. And that has been the guiding principle since the Royal Commission handed down its findings under the Morrison government. Prime Minister Anthony Albanese made a range of commitments ahead of the 2022 election, and we've worked tirelessly since we were elected to government to pursue that ambition: safe, dignified and high quality aged care for every older Australian.
Now, in terms of assessments, because this is the system that's been in place now, privatised assessments that's been in place since the end of last year, what happens in the most urgent cases, like the one that we referred to in our story? Should you have a priority system for those most urgent cases to make sure that people get assessed immediately?
The assessment process has historically been very complex, Sarah, and you're right. At the end of last year, we put in place the single assessment system. This was a key recommendation of the Royal Commission. and that has gone through a period of maturing over the last 11 months. And we're now starting to see the benefits of that new single assessment system, both in terms of the experience of older people and their families that are interacting with the system, and of course in terms of the measurement that we do at a government end. The median assessment wait times at the moment is 23 days, and just in the last quarter we saw that improve by 8 days. So we are seeing rapid improvements, but of course I want to see older people and the people that love them being able to access an assessment and care system that is agile and able to respond to their needs. So we'll keep working to make sure that that assessment system is part of a broader ecosystem that is responsive to the needs of older people in our community.
Look, obviously medians can be very misleading, but just stay with this issue of priority because it's obviously at the sharp end of people's experiences. Why don't you have a priority system when someone who has a whole series of red flags around their situation, like the gentleman in our story, that their case doesn't get pushed up the system? Why should someone in a priority setting like his wait so many weeks, in fact, in his case, too many weeks before getting reassessed?
Well, we don't want anyone in a situation where they are waiting for such a long period of time, Sarah. It's why these reforms have been so critical. As I said, that median assessment wait time for the last quarter is down to 23 days. And you fairly make the point that there is some variability around that, and we'll continue to invest in the assessment system so that no matter where people live in Australia, they can continue to access those assessment services. In terms of the way that our national priority system works after the assessment, we like to make sure that everybody who gets a clinical assessment of high priority receives their care packages within a single month. And that's part of the way that we prioritise the distribution of care. So it's both equitable as well as responsive to the needs of older people.
And if you're able to just give me a yes or no answer on this one, Sam Ray, are people waiting longer for assessments than they were under the old system?
No. Assessment wait times are considerably improving. As I said, just in the last quarter, we saw that improvement in terms of the median time coming down by 8 days. We'll continue to drive that assessment wait time down.
But what about a priority system for the people in the most urgent need of care?
We want a system that provides efficiency on an equitable basis, Sarah. Roughly 40% of assessments that occur across Australia are conducted within the state and territory health systems, and often that is the space where people who have high or complex needs are assessed, and the wait times there are very low indeed, sometimes less than a day. So there are systems in place to make sure that people who have the most acute needs do receive both assessments and care as quickly as possible.
On co-payments, obviously co-payments are anathema to the Labor government in Medicare. Why do they belong in aged care?
Well, we want to ensure that with that ageing population and the dynamics that that brings, that we have a sustainable system, and as I said before, that system is equitable in terms of its access. Means-tested co-payments, and that's very important, means-tested co-payments are a critical component of ensuring both the sustainability and the equitability of the system. The federal government will continue to pay for 100% of all clinical care for in-home care recipients. And then there are some means-tested co-payments where people have the means to make a co-payment for their care. They are being asked to do so. Importantly here, Sarah, that has to be done and implemented with a robust system of protections in place for people who are of lower means or who have particular vulnerabilities. We have systems in place to ensure that if people aren't in a position to make a co-contribution or their circumstances evolve, that there's not an interruption to the continuity of their care.
So how do you prevent the poorest Australians from foregoing the care that they need because they determine they cannot afford even the modest co-payment that you're asking?
Well, again, 100% of all clinical care costs are met by the government, and then we have very robust hardship provisions in place. So if a person's circumstances evolve and they are unable to make a co-contribution, the hardship provisions provide such that their care is continuous and there's no interruption, and that their co-payment doesn't become a hindrance to them accessing the care that they need.
And do you accept that it will be a threshold succeed or fail for you if those wait times can't be brought down, wait times for assessments for elderly people?
As I said, Sarah, we've been working on this this is a generational reform process and it has many aspects. This is a complex system, the aged care system, and we would like to reduce some of the complexity through these reforms, but I also want to be very straightforward with people that we won't be able to reduce all of that complexity. We've already seen significant improvements in outcomes for older people. Over the last couple of years, we've seen an additional 7.1 million minutes of care delivered to older people every single day. We now have 24/7 registered nurses in residential aged care facilities, and we've invested $17 billion in wages for aged care workers so that we can retain and attract the very best human beings to provide this very special care to the people that we love. Saturday was a big day. It marked the beginning of the new Aged Care Act, and with that, the Statement of Rights for older people, as well as the Support at Home program. Assessments are a critically important part of the work that we're doing, and I will remain, as I am focused on all of the reform program, I will remain focused on the assessment part to make sure we get that right, along with the rest of the ecosystem that ultimately delivers the best care outcomes and ideally joyful quality of life for older people across our country.
I'll just note that you didn't answer yes or no whether it would be a threshold success or failure for you, but you've given us an expansive description of the new system. Sam Ray, thank you very much indeed for joining us.
Thank you, Sarah.